Let me reiterate that the directive that closed down bars that sell alcohol has also not been lifted, because there has been those who have been saying that they are now free to start partaking of some of these things, some of them even saying that they are now free to order one Kagwe special. I would like to clarify that that is not the case. And we have also noted that various facilities opening for business and selling alcohol are on the increase, particularly in some estates in Nairobi, in Westlands, in the Kilimani area. We have taken note. And I would like to propose to the owners of those places to quickly, very quickly, follow the directives that we have given. So I want to emphasize on the importance of individual responsibility in this fight. As we consider opening up more and more, it will be important that every person plays his or her role in the quest to limit the spread of the infections. It is now close to 90 days since our first case, and in that period, we are now better informed about our individual responsibility in this campaign. And I would like here to thank those in Nyumba Kumis, particularly upcountry in the rural areas, who have taken a very serious attitude about new entrance into the community, a new entrance into the counties, and reporting any case, particularly the cases of individuals who have traveled from epicenters of the disease, such as Nairobi and Mombasa, traveling upcountry. And I can tell you that they have taken it seriously. I want to thank the chiefs. I want to thank the sub-chiefs, chairman of Nyumba Kumi. You are doing a sterling job in informing the authorities and ensuring that you as a community speak to persons concerned and ask them to leave as quickly as possible. And that has been effective. And it is going to be even more effective when we start community health care, community care, and also more effective when we start quarantining in homes. Because it then becomes the responsibility of the Nyumba Kumis, the responsibility of families, the responsibility of sub-chiefs to ensure that those who are self-quarantining do so. It's because there will be those who will do so very effectively and very efficiently, but we are also aware that there are Kenyans who will not do that. So I would like to urge that that be the case. Today at our National Emergency Response Committee on Coronavirus, we proposed that the 47 county emergency response committees are to meet very urgently. As you know, they are shared by the governors and the county commissioners, that we urge them to take advantage of a 2-week period. Within the next 2 weeks, we accelerate and ensure that the directive of the minimum 300 beds is achieved, because it is very, very important that we do this. Otherwise, the extension in the time that the president gave, will not mean much. So we must make sure, as you are aware, we have dispatched money to the county governments. Originally, they were struggling. We have dispatched money, and we will continue to support. But I think that the idea of them being ready is crucial in the next phase of the management of this disease. And it becomes important because the numbers are not going down. The numbers are going up. Today, for example, is our highest ever report of 167 positive cases in the country out of some 2,833 samples tested. Now, it is also important for us to understand that this high number is also as a result of extremely targeted testing. When you look at the areas that these numbers come from, you'll see, for instance, there is a huge number from truck drivers in Busia and the other border counties. For instance, Nairobi has 54 has 54 cases, Mombasa has 47 cases, while Busia has 28 cases. Now, in the case of Busia, we realize that these are essentially truck drivers, but we are also going to have a government direct intervention in the Busia County because of the rising numbers that, that they have got there. But even the other counties are also increasing in numbers, including counties like Kiambu, now growing at 14 new cases, Uasin Gishu with some 11 cases. And the Uasin Gishu, the 11 cases come from Soy. Soy has got 5, Tabo 3, and there is a case from Kapseret, from cases. So it's spreading in the counties, and this is why it is so critical that we ensure that counties begin to take responsibility. I think the test of a devolved system is going to be now, whether indeed devolution is going to work, whether indeed health as a devolved function is what it should be. I think this is a good test, and we are seeing a mixed bag of performances, with some counties doing extremely well and others lagging very far behind. So it is important that we all put it all together, and we have a general standard across the country so that each county has got sufficient capacity. In gender terms, we still continue to observe that the male gender is taking a huge percentage of these things, of these positives. I think more so because, for instance, when you look at truck drivers, you know, almost all of them are male. And therefore today, we have got a situation where 125 of the positive cases are male and 42 are female. Again, the reason why we keep on saying that those who are unwell, you know, must quarantine themselves is because when you think about it, today, for instance, we have an 11-month-old baby who has turned positive. In terms of discharges, today we have also discharged some 46 patients, which is a good number for discharge, but I wish we were discharging as many as we are bringing in, which brings the number of recoveries now to 752. Sadly, we also lost one person, bringing the total of fatalities to 84. Today, we celebrate the National Cancer Survivors Day, an annual event held globally to honor cancer survivors and to show that indeed life after cancer diagnosis is possible and can be fruitful, rewarding, and inspiring. This day is an opportunity also to raise awareness about cancer and the importance of screening for early diagnosis. If we are to achieve better treatment, outcomes, and cancer survivorships, the key is early diagnosis.
Today we are at county 36. We have 36 counties which have now positive COVID cases in around the time when now we are 90 days into this disease. This means, therefore, slowly and surely, this disease is permeating into the counties. Also, we are reaching a time when the decision has been arrived at for management of COVID cases at home after a certain period of management at government health facilities, which means more responsibilities are falling onto counties, more responsibilities are falling onto communities, and more responsibilities are falling onto families.
Home-based care is not a new intervention in the health arena. It has been used before. Remember, during the advent of HIV, when our hospitals were swamped with cases, we quickly developed home-based care guidelines, which went a long way in relieving the stress of the public health facilities specifically. And that we did with very good outcomes. So for home-based care for COVID-19 based on the WHO guidelines, which we are going to customize locally to suit our needs, one criteria is that you must have a COVID positive report from the laboratory. Number two, you must be asymptomatic or you have a very mild form of the disease based on the triaging by the doctors and the clinicians. Number three is that you must have no coexisting comorbidity like high blood pressure, diabetes, chronic chest problem, chronic kidney problem, and the likes. Number four, you must have adequate space, preferably a separate room from the rest of the household members, where you'll be able to stay during this isolation or quarantine. This space must be well ventilated so that the risk of spread of the disease within the household is decreased. Then, of course, you must adhere strictly to the infection prevention control guidelines that we have continued to articulate here over and over again. The issue of washing hands, the use of the sanitizers, you must have a mask. The caregiver must also have a mask. We will propose that no visitor would be allowed into that particular room where the person is isolated or quarantined, except the caregiver. Then you must, of course, have access to PPEs, like gloves. You must have access to maybe a thermometer to be able to check the temperature. Then working together with the healthcare, community health volunteers and other healthcare workers within the vicinity, we'll have a plan for a referral in case your condition changes. So you must have an identified facility to which you can quickly be referred if you require further care. Of course, it is paramount that you continue. If you are taking other medicines for any other reason, then you may need to continue to take those medications.
We are also going to use KMTC, Kenya Medical Training